Hi, Allie. Thanks so much for taking the time to speak with us.
Yeah, of course.
You ready to answer a few questions?
Yes.
Okay, let's start with your name.
My name is Allayna Tyree.
And your occupation.
I am a family nurse practitioner in family medicine in the residency program here at Benefis.
And tell me more about the role of a nurse practitioner in primary care.
Yeah, so as nurse practitioners, we are providers, so we see patients in the clinic. We do health assessments, we make diagnoses, we order testing, prescribe medications, and provide ongoing care education and management, focusing on health promotion, disease prevention, and guiding our patients into making healthy lifestyle choices.
And tell me what led you to medicine in the first place.
For me, kind of started with my mom. So my mom was a nurse, and she kind of initially led me into healthcare, but I started in healthcare when I was a sophomore in high school, starting as a file girl at a doctor's office, and then as went and got my CNA license, worked in the hospital, then decided to go to nursing school, got my bachelor's degree, and then decided to go back to school and got my doctorate degree. So I've kind of just always been eager to learn more.
And what a journey.
Yeah.
Tell me some more interesting facts about nurse practitioners.
Yeah, so I think one interesting fact, especially here at Benefis, is that Benefis employs, I think right now, like 80 some nurse practitioners, so there's quite a few of us. But on a national level, there's over 355,000 nurse practitioners, and 36,000 that just recently completed their academic program, including myself. So, but another interesting fact is that 75% of nurse practitioners work in a primary care setting, and nearly 80% have certifications in primary care. So that's a fun fact.
Interesting stuff.
Yeah.
What's the most unique part of your job?
I think for me, the most unique part working as family medicine is just the variety of patients that I get to see. As a family nurse practitioner, we can take care of infants and toddlers all the way through elderly and geriatric, and then also just a wide variety of diseases from acute and chronic, really from all subspecialties of medicine. So,
what do you wish patients knew before they came to see you?
I just want patients to know that when they come to their appointment, that time is devoted to them. So not to be afraid to ask questions or really get involved in their care.
Do your family members and friends ask you for medical advice all the time?
Yeah, sometimes, but I'm kind of nerdy about it, so it doesn't really bother me.
Works out then. What are some common misconceptions in healthcare that you see kind of being spread around?
I guess one common misconception is that if you're sick or you have a disease or condition that you have to go on medication or a pill or something to treat it, and that's just simply not true. A lot of the times our lifestyle choices, our diet and things like that alone can prevent and even manage a lot of diseases.
And how about what you love to do outside of medicine?
I guess my main thing is just spending time with my family and friends, but I also like to get outside and do camping, boating. I also really like to read.
And what's your favorite thing about Great Falls?
My favorite thing about Great Falls is how centrally located it is in Montana, but also that we have the Missouri River right here in town. You don't have to travel very far to play in the river if you want.
Definitely true.
Yeah.
And finally, what's your favorite thing about your job here at Benefis?
My favorite thing about my job is, of course, my patients. I think we would all say that. But I feel like as providers are really in a unique position in our patients' lives. And, of course, it's always great to see people heal and get better. It's just a really great thing to be a part of. So,
thank you so much for taking the time to speak with us. All right, and happy Nurse Practitioners Week.
Thank you.